Grace, do you mind admitting people when they start to jump in?
Yep, I can do that.
Thank you. Okay, well, thank you all for coming to our Health ECE Partner presentation. We're glad you're all take part of time out of your lunch hour to join us. Today, we'll be covering some partnering inspection tips for success. And I want you all to be thinking, what did you do during the power outage and how would you prepare better next time? We'll talk about outbreak reporting, and then thinking January, February, March is a good time to recheck your first aid kit to make sure it has all 9 items that we require in the inspection. And then we have a special guest speaker today, Sarah Lopez from the state, to give us a vaccine update. Si Ning, our outbreak epidemiologist, will tell us about superflu and resources for spring break travel. And then Jane Wilkinson will provide us with 35 years of ECE wisdom on 3 slides, and then we'll have updates from our partners, ECCBC and CCAP. So let's get started. To begin with, we always just like to thank you, especially before Valentine's Day, for all the love and help that you give our children to make and keep them healthy. We know this is a busy time of year with lots of outbreaks with influenza A, influenza B, RSV, GI issues, and noro. So thank you so much for all the love and care that you give to our children. We really appreciate you. So to begin with, I'm curious, how did your facility respond to the power outages? You can take yourself off of mute and just share, or if you want to put something into the chat. I know at Boulder County Public Health we had quite a few phone calls and emails that we tried to help people out. I know personally I found out we needed to put batteries in all of our flashlights. I realized that we didn't have that our batteries were worn out, and so we needed to put batteries in all of our flashlights and put it in places in our home that it was easily accessible. I'm grateful, Suzanne Heron, no outages there. That's wonderful. So during this, some of the power outages, our communications team actually created a web page on our Boulder County Public Health website to help you prepare and think about what to do if we have future outages. So one thing is that cold food must stay at 41 degrees or below. So I know some facilities started to buy ice bags as well as coolers to put some of those food in those coolers with ice around it because they didn't know whether it would be 24, 48, or 72 hours of power outages. If any of your staff or children have refrigerated medications, think about the same thing. Keep extra ice packs and coolers ready. And then think about how are you going to maintain the indoor temperature of 68 degrees Fahrenheit or above, especially in the infant rooms and toddler rooms. And then hand washing, you just continue your proper hand washing at the required times. So when children enter for the day, when they come in from playing outside, after they use the restroom, and before they eat. And it's important if the power outage exceeds 2 hours, follow your emergency protocols and notify parents immediately. And thank you, Si Ning, for putting the new web page in our chat. So, quick question here. What should you not do during a power outage? A, if power outage exceeds 2 hours, follow your emergency protocols and notify parents immediately. B, open the freezer and check to see if the food is still frozen. C, have a plan for medications that require refrigeration. D, consider having extra bags of ice on hand to place around refrigerated food to help keep items cold longer after power is lost? So you can put your answer in the chat. What should you not do during a power outage? And Stacy, thank you so much for commenting in the chat. Our facility updated to LED lighting, and so they were no longer, and noted that the emergency lighting no longer worked. We were able to update the needed switches last week. We only had 1 day of no school due to power. Yeah, so some of those things you can only learn. We're all learning by doing. Okay, and so what you should not do, good job, B, open the freezer and check to see if food is still frozen. Our Boulder County Public Health Emergency Team has told us that if you keep your freezer door closed for 40, it can keep food cold and frozen up to 48 hours. And interestingly enough, the more your freezer is stuffed, like I still actually have a turkey from Thanksgiving in our freezer, which acts as a huge ice block. And so the more items in your freezer, the longer your freezer will keep things frozen. So what you should not do during a power outage is to peek and see if the food is still frozen. Okay, what are other ways to partner for successful health inspections? Grace and Jane and I have been very busy doing quite a few health inspections, and I just wanted to do a shout out to Alex at Adventure Montessori, and he found a waterproof pillow. So you need to wash the pillows, and often people will take the coverings off the pillows, but we're always so concerned, what if a child had a leaky diaper, and then the leaky diaper went through the cover and onto the foam underneath? Well, he went online and found a waterproof pillow and bought them all, and since then he hasn't been able to find any. So if any of you know of good sources for waterproof pillows, you can contact me, and he would love to know that as well. So well done, Alex from Adventure Montessori. Thank you so much. And Grace was at an inspection, and another great idea from you. Go ahead, Grace.
Yeah, hi everybody. I'm Grace Peterson. Might know me from inspections. I'm one of the child care health inspectors at Health. And I saw a really good idea at Scuttlebugs in Boulder. This is one of those kind of modular foam pillow cushions, that you can buy and build like forts out of. But what they had done to help make it more easily cleanable, as you can see, the zipper is zipped open, so the cover does come off and you can wash it. But like Martha said, if there was some kind of spill, it would just go straight through the cover onto the foam, and then how do you wash the foam block? So what they were doing at Scuttlebugs is they had the kind of plastic tablecloths that you can buy like for a cheap outdoor picnic or something like that, and they had wrapped it around the pillows and then covered it up with the zipper. So this is just, one of those big plastic tablecloths just folded around the different blocks. So I thought this was a really good idea to help it keep it clean. And you could use it for all sorts of big pillows and cushions. So thank you, Scuttlebugs, for letting us share this example.
Okay, thank you, Grace, and thank you, Scuttlebugs. We appreciate all of you for all your great ideas that we learned from you during inspections, so thank you. So our next topic is, with this increased illness during these winter months, we have created an increased illness reporting tool, and many of you have already used it, so thank you very much. By using this link, which will only take you about 3 to 4 minutes to fill out, we can gather information quickly about your facility and are able to help more people quicker. So thank you to all of you who've already used this reporting tool, and I hope many of the others of you use it in the future. And a lot of the information you have off the top of your head. How many children do you have enrolled? How many classrooms? How many children are ill? How many staff are ill? And is anyone hospitalized, staff or children? So thank you so much to those who have used this reporting tool that we created. In addition, We appreciate you also using all of the resources that you have on hand for you. If you noticed an increase in illness, we have the infectious disease manual, and part of that infectious disease manual, there's one page that tells you if a disease is reportable or not. Many of you are already using the How Sick is Too Sick, which really helps with symptoms and exclusions. And then the guidance for the prevention and control of viral respiratory illness in childcare settings has been updated. So we have a 2025 to 2026 guidance. And thank you so much, Primrose, for putting in the chat, how do we access this tool? So I think Sining will find the link and she'll put it in the chat with the tool with outbreak reporting. Thank you so much for asking that. And then if you find those 3 resources you need a little bit more help, Sining and I are happy to answer your health and outbreak questions. So please email us at healthece@bouldercounty.gov inbox. So thank you, Sining, for all of the references, and then they might want the link to the Microsoft Forms. Perfect. Okay, and then the other thing I mentioned earlier is January, February, March is a great time to recheck your first aid kits. And as you know, supplies should be provided, kept in clean storage, conveniently located, available to staff for emergency use, but not accessible to children. And these are the 9 items that we'll be looking for. The gauze pads, the rolled gauze, adhesive tape, cold pack, plastic bags, disposable gloves, bandages, mechanism for cleaning hands in a remote location, and scissors. And then please note as you're going through your first aid kit to discard any expired first aid supplies, equipment, as well as medications. I noticed recently that in one classroom we looked at the first aid kit and the child wasn't in that classroom anymore. They had graduated, I think, and gone on to kindergarten, but they still had the medication and it was expired. So those would be, make sure you discard those items. And then I know I showed this slide last quarter, but I just thought, again, this was such a great idea from one of the schools that they could bring the first aid medical supplies outside, and they're conveniently located, but some of the staff were saying that the backpacks are so heavy that they're too heavy to carry, and they knew they had to not be accessible to children. So they worked with the custodian at this school and put that holder on the brick wall outside the school. So good job again, you all. Now we get to have a special guest speaker today who will talk about vaccines. And we have Sarah Lopez, who's from the state of Colorado, and she will give us an update on vaccine requirements in the state of Colorado. And give a quick wave there, Sarah. Thank you so much for being here.
Thank you so much, and it's really wonderful to be here with you all. Next slide, please. So I'm here to share about our recent Board of Health rulemaking that occurred in December. And Martha, can I get you to give me a thumbs up if you can hear me okay? Okay, perfect. So I do want to reiterate to you that while changes were made to the Board of Health rules, this isn't another thing for your plate. This is some changes that were made to incorporate best practices or just changes that were technical in nature to the schools. And Colorado remains business as usual for the immunization requirements. So let's dive in. Next slide, please. So as I mentioned on December 17th, the Colorado Board of Health revised the rule that establishes immunization requirements for all students attending school and child care centers licensed by the state of Colorado. We did make updates to our webpage. We had an updated landing page, so just put that in the chat for immunization requirements to attend school And then we did launch a few new pages. So the second one that I'm putting in the chat is the immunization requirements to attend childcare in preschool. And so we're hoping that these parent-facing, family-facing web pages help families to better understand the rule at a baseline and understand how to navigate through the rule. And then on our landing page, about halfway down is a section for information for school and childcare professionals, where we just added to our news and announcements a few resources, such as the explanation of key changes to the rule, and then the implementation table that talks about when these different parts of the rule go into effect. So this kind of gets into the weeds, but really a lot of the changes that were made were just meant to clarify the interpretation of the rule and weren't hugely substantive in terms of changing. Like there's no changes in adding or subtracting vaccines that are required for school. There's no changes in the exemption process for school. There is a slight change to the medical exemption form where we'll soon be adding an option starting in the next school year for providers to write a temporary medical exemption for temporary medical contraindications to receive one or more school required vaccines. So for an older student or college student, that could be pregnancy. For any child, that could be, taking medication or treatment that would significantly inhibit the immune response, where an immunization might be not safe for that time, but then they might want to revisit that conversation later. So overall, lots of technical changes, not a ton of substantive changes. Next slide, please. So I do want to reiterate that Colorado is business as usual, and we are certainly following the changes to the federal vaccine schedule. Those are not going to change the schedule for immunization requirements to attend school and childcare in Colorado. We did move from the ACIP immunization schedule, the federal schedule, to the AAP immunization schedule. So that's the American Academy of Pediatrics 2025 recommended child and adolescent immunization schedule. And that schedule is with outside of a very small few technical changes, by and large, the same schedule that we've been using for a number of years now. It hasn't, the Hep B, for example, schedule has not changed all that much. The polio MMR schedule, these have been in place for some time. And CDPHE does recommend that families and providers follow this schedule, which is developed by infectious disease experts and reflects decades of peer-reviewed evidence and safety monitoring. AAP has been publishing and issuing evidence-based recommendations, their immunization schedule, for nearly 90 years. You may not have known that, but when the federal entity puts forth their immunization schedule, AAP does so as well in their publication called the Red Book, which is where they put out, all of their technical guidance for treating infectious disease, responding to infectious disease in the pediatric population. And they have been harmonized outside of this year for about 30 years going back. So all to say, to summarize that conversation, if you have families who have questions about immunizations, please refer them to the CDPHE web pages. Please continue to enforce the immunization requirements as you have been doing in the past. We have resources for childcare providers on our web page. And I'll, sorry, let me get that to you. Where you can find the immunization table and continue to enforce the immunization schedules that are evidence-based. And if families have questions, right at the top of our school immunization required webpage, we have this statement here, so they can hear it from the state, and we do stand up a group of nurses. Every day we take a call. So of course you can contact, and talk to your local health department in Boulder County. If families want to talk to the state health department, we're also available and happy to answer their questions. Next slide. Okay, so I know that immunization schedules can be pretty complicated, sometimes in the weeds, and so you do have a lot of other resources. Your child care health consultants are, a wonderful resource. They're there for your school health questions. And can help you reiterate that the majority of Colorado families choose to protect their children through vaccination, and that your school nurse supports immunizations. We want to continue to have and promote confidence in immunizations, because we do have a lot of confidence. We do have a lot of evidence that this is really the gold standard and the best way to prevent against vaccine preventable disease. You can refer to the child's pediatrician. They have that expertise and the expertise in that child's health. And we want them to promote, of course, and they will promote that routine vaccination can prevent diseases like measles, mumps, varicella. So kids can just be kids, and they can answer those specific questions. And then, of course, our webpage, as we've been talking about. Next slide. And your role really, really matters in promotion of immunizations. You are trusted amongst your families to care for their children, and so I think your opinion on this absolutely carries weight. So we ask that you please continue to support and promote immunizations. Perform the immunization data survey on an annual basis. And, we know that vaccines help keep kids safe, but some children and even adolescents or adults, they can't be vaccinated and they rely on herd immunity. And Martha,
immunity or herd immunity means this.
We'll play a short video.
Yeah, it's very short.
While getting vaccinated provides excellent protection, you actually get even better protection when most people in your community are also vaccinated, because it prevents outbreaks from actually happening. That additional protection not only helps you and your family, but it also helps people who are too young to be vaccinated, people who can't get vaccinated because of certain diseases, and those whose immunity has actually worn off. I like to use an analogy when I explain community immunity. Think of germs like the rain. When you get vaccinated, you're actually putting on a raincoat to protect yourself. But the best way to protect yourself is to have an umbrella and a raincoat. You can't get that umbrella by yourself, though. The entire community has to come together to buy that umbrella, and the way they do that is by vaccinating themselves. And that provides best protection for everybody. Not only does it protect you, but it also protects people who can't get vaccinated and can't wear that raincoat. And that's children who are too young to be vaccinated, people who have certain diseases who can't be vaccinated, and those whose immunity has worn off. When 90 to 95% of your community is vaccinated, it keeps outbreaks like measles from happening. We know this because we've seen it happen. So the best way to protect you and your family is to get vaccinated, but make sure that your neighbors and classmates do the same.
Okay, great. I think that video is super helpful to share with families and with your staff on the importance of vaccines. If you want to learn more about the changes to the rules or changes that are happening federally and how the immunization branch is responding, we have a training and a Q&A next Tuesday, and I'll put the registration information in the chat here if you would like to attend. It's from 6 to 7. Next slide. Okay, that's all that I have. Bixby, in response to your question about temporary medical exemptions. That would only be if there was a true temporary medical contraindication to either one or more vaccines. And so if somebody were catching up for school-required vaccines, if they were following the minimum intervals, the minimum of the catch-up schedule, then they'd be on an in-process plan. And you'd want them to be, going in, getting caught up to their age as soon as possible. If they were on a catch-up schedule that did not follow that, and they wanted to delay even further, then they would need an exemption on file until they got caught up for that vaccine. I hope that's helpful.
That's wonderful, Sarah. Do you mind putting your email address in the chat if Bixby or anybody else would like to follow up with you? But thank you so much, Sarah, for just giving us a big picture overview. We're business as usual in Colorado, and that people just need to use their resources as well. Child care health consultant, the website, and pediatricians. So, and please sign up if you want to know more at the Zoom meeting that Sarah just put in the chat. Thank you so much.
Thanks for having me.
Well, now we have, thank you, Sarah. So now we have Si Ning, who's our outbreak epidemiologist here at Boulder County Public Health. We're going to talk about superflu.
Sorry. Hi, everyone. Like Martha said, my name is Si Ning. I'm one of the epidemiologists here at Boulder County Public Health, and I'm going to speak about superflu and then some travel tips today. I just have a few slides. So next slide, please, Martha. So I know that the superflu has been talked about a lot in the media. I've shared a couple headlines here on the right. It's kind of like this big buzzword that's been floating around. So I wanted to touch on it, make sure that you guys are hearing straight from public health kind of what that is and how it's affecting us. So what is the superflu? So the first thing to know is that it's a media coined word. It's still influenza, but basically it's just a stronger strain. It's caused by the H3N2 subclade K. So why is it super? It spreads faster than usual strains. We don't have a ton of information on why this might happen so far. Of course, there's always data coming in and more information coming in as we speak, but it does cause more severe symptoms, higher fever, body aches, vomiting, diarrhea. And then another thing that causes it to be more transmissible is that this year's flu vaccine does not fully cover the superflu. So while it still can prevent you from getting more ill, it's not fully effective at preventing you from getting sick. It is linked to higher hospitalizations, especially in kids and older adults as well. And then some people are also reporting that the symptoms are persisting longer than the normal flu would. So how do we handle it? The biggest takeaway is that the same prevention methods are going to work for the superflu. So flu vaccines, hand washing, of course, and then staying home when sick are what we recommend in order to prevent any superflu from getting into your facility or spreading in your facility. Next slide, please, Martha. This slide goes over superflu in the US, or specifically influenza-like illness activity in the US. This year's peak reached the highest peak that we've seen since 2010 to 2011. This was updated in January 31st, so it's pretty recent information. Our peak happened kind of at the end of 2025. It had around 12.6 per 100,000 population of influenza-like illness activity. About 91.5% of these subtyped cases have been attributed to the superflu. Not every single test result is subtyped, so that's something to keep in mind, but you can see here that a majority of the cases that have been subtyped have been superflu. About 60 influenza-related pediatric deaths have occurred across the United States, and then the CDC estimates that there have been at least 22 million influenza-like illnesses, 280,000 hospitalizations, and 12,000 deaths from flu so far this season. So some of these go like underreported, or people might not seek care. So these numbers are projected in some way. This map on the right gives you a good idea of how it's distributed across the states. So you can see are in the purple, which is in the very high activity category. This was kind of in early January as well. At this point, you'll kind of see in the next slide, but the influenza-like illness has kind of slowed down, but we typically see 2 peaks per flu season, so we might see cases start to ramp up again. Thanks, Martha. Next slide. So here on the left, we have some stats about Colorado, and then on the right is a dashboard that my team publishes that gives us a better idea of how respiratory illnesses are circulating in Boulder County specifically. So on the left side, we have our statewide data. So this was shared by the state. I believe it was also early January. So I don't know how it's progressed since then, since we haven't gotten an update. But in early January, they reported that in late December, 831 flu hospitalizations were reported in 1 week. That was the highest weekly number they've had in 2 decades. There is a large pediatric toll with 3 child flu deaths being confirmed in Colorado this season. And then vaccine coverage is about 27.5% of Colorado residents. That's a little bit lower than last year. And then here on the right is that dashboard that I mentioned that our team updates weekly, so it should get updated today. But you can see that we had that huge peak kind of late December, early January. I think it got up to like 8.3 per 100,000 population or something like that. It's that the dashed line, the pink dashed line would be an influenza-like illness. So you can see that it's dropped since then, but it is, like I said, probably likely that we'll see another peak here in the next coming weeks, just due to previous seasons and how that has panned out. Next slide, Martha. And then this is also shared by the state. So January 7th is when they share this information. We haven't gotten an update from them since, but you can see that right box on the right, or the right box, that was repetitive. You can see that we have had a good number of school and child care facilities report influenza-like illness and report outbreaks in their facilities. Of course, this is obviously an underreported number because there are many facilities that might not report to us, or maybe they don't get reported to the state. But you can see that it did definitely peak in that end of the year time period that I had showed you in the previous slide. Next slide, Martha. And then some key takeaways, which I think is probably most important out of all of these slides, is that 1, vaccination still matters. Regardless of if it's not fully effective against this strain, we still know that the flu shots reduce the risk of severe illness, hospitalization, and death. So you might still get sick from the flu, but you won't get as sick as some other people. And then also kind of bring us back to Sarah's point, is that the more people that are vaccinated, the higher protection there is for other people that can't get vaccinated, maybe are allergic to the flu vaccine, something like that, right? So it protects our community when most of us are vaccinated. We also want to make sure we're protecting children. Since most pediatric flu deaths are among the unvaccinated, we want to ensure all eligible kids receive their vaccines. And then everyday safeguards that you can take are washing hands very often for at least 20 seconds with soap and warm water, and then enforcing any symptom-based exclusions that you have in your facility. The other thing that you can consider if you see things spread is we can consider masking if it's crowded, or if that's available to your age group. The other thing, since it's been a warmer winter, is that you can open some windows to increase ventilation. Those can also help decrease transmission in your facility. And then the last thing is that you can be prepared. So it's always helpful to monitor any kind of flu activity from the CDC, from CDPG, from us. I know I do these presentations quite often, but we do them every 3 months, which is not really giving you a great idea what's happening right now. There are a lot of resources that I shared in our last presentation, which I think was in November or December, where you can monitor flu trends or respiratory illness trends. Thanks, Martha. Next slide. And then I just wanted to give you some travel tips, because I know that spring break is coming up, and we know that with spring break, kids always come back with illnesses. One thing that we're worried about this year is measles, as we've talked about a lot. So Martha, you can go to the next slide. I just wanted to give you some resources in order to determine risk level for places that people are traveling or places that you might be traveling. So there is a newish CDC vaccination map. Again, I put these slides together in January, so it's not super new anymore. But this vaccination map gives you a good idea of what risk level might be based on vaccination vaccination percentage in that area that you're traveling to. And then it also tells you kind of like what measles activity might look like in that area. You can also bring it down to even the county level. So yes, the statewide data is important, but if you want to like bring it even more nichely to the area that you're traveling to, you can put in the county that you'd be traveling to as well, and then it'll give you data for that area. The Johns Hopkins measles case map is also very helpful. It tells you where it's pretty straightforward. It tells you where measles cases are across the country. Also considers vaccination status as well. And then as of February 5th, 2026, CDC does report that 733 confirmed cases have been reported this year across 20 jurisdictions. A majority of those are associated with 2 outbreaks, specifically in South Carolina and in Utah. So if you're traveling to those locations, maybe take a gander at that CDC vaccination map or the Johns Hopkins measles case map to see exactly what part of the state you are traveling to and if it's associated with that outbreak. And then, again, reiterating measles vaccination from that last bullet point, most importantly, we want to ensure all of our children and staff are fully vaccinated at least 2 weeks before travel so they can have some coverage. And then kind of back that up, about 95% of our cases this year have been either unknown vaccination status or unvaccinated. So definitely consider vaccinating before you travel. Consider getting early childhood vaccinations if you're bringing an infant across or into a state that has a lot of measles transmission. And I think that's my last slide. Thanks, Martha.
Yeah, thank you, Sing-Ning. Thank you for telling us all about super flu and how to protect ourselves with spring break coming up. Thank you so much. Now, Jane Wilkinson will be talking about her 35 years of ECE wisdom on 3 slides as she slides into retirement. But as you all know, Jane, she couldn't contain it to 3 slides. So we actually have 4. So take it away, Jane.
Thank you. I can relate to this owl. I feel a little confused. So yeah, I couldn't keep it to 3 slides, so I won't. And 35 years of wisdom or experience or something is more than I could put into 3 slides. And as Martha said, I did, I guess, fully retire or partially retire, semi-retire in December. And yeah, thanks. That one, yeah. And I'm now working hourly on a contract sort of basis through end of June to help with that transition. So next slide. So that transition is what some of you have been asking about. Where's Jane? What's happened to everyone? And on a high level overview, Child Health Promotion, the group that you knew of, me, Kara, Martha, has added Grace and another person, Carly Wilson. And I think some of you have met Grace. Martha's been working with this group for 3 years now, almost 3 years. And so we're transitioning into environmental health, which really isn't going to change much for all of you. It is making the team that we have more resources, and we're trying to make more of a centralized contact. You'll continue to use the Health ECE, which Martha Seening backs up, and that team on any sort of health outbreak sort of questions, communicable disease, and then the email that you would have gotten, you have been getting your child care health inspection, that health CHP at bouldercounty.gov is going to be more of our general email. In the past, we weren't managing that. It didn't have a reply. It does now. So that's also going to be a team sort of response rather than one person, me or Martha or Grace or any one of us. Those emails will be managed and watched so that you have greater access to your team of child care experts. And within environmental health, we have access to resources that we hadn't we didn't have quite as much access. We have more access now with the other environmental health departments and divisions and people that have differing but really important expertise that we use and we call on now are a part of our team. So I feel like this is a really great time for integration, a great time for moving child health promotion, and a good time for me to exit with new people around. I'll be helping with the transition. I'll be around in Boulder County, still doing some work with the Early Childhood Council. And the wisdom, the experience that I had really does lie in this system. So next slide, Martha. And it lies in this system because public health is part of a circle, part of a system that supports you. And I know you've heard a lot today, and in many of much of our work, we talk in numbers and graphs and charts and data, because that's how we can make decisions. That's how we can get information. But in the end, the child, the baby, the family are really the center of this focus. We all care about that baby and that child and your work within that circle, because that's the vulnerable part. That's why we create this department. And public health is a community collaborator. That is really the design of public health, to reach out to the vulnerable parts of our community. And in our case, that's the child, that's the family, that's you. As a child care provider, you're a vulnerable population as well, working with multiple families. And then as the circle goes out, and you've seen different versions of this in other trainings, I'm sure, we are involved in networks with policies, with grants, with funding, with environmental health. It kind of expands our reach into those areas. So just to reiterate that the baby is still a child and not a number in the middle of this chart, and that's the most important thing in our work. Takes a village, right? It really is all of us put together, the families, the children. You as a caregiver are vulnerable, you're exposed in all of these areas. Your work is a labor of love. I know that it's a way of being, the work that you do, the care that you provide for children and families. And we're there as your partner, as your collaborator. Last slide, I think. And we've learned so much in these opportunities of natural disaster, fires, floods, and then a global pandemic. And in the end, if we really think back of how that's changed our systems, how that's changed our funding, how it's changed our protocol, we just get stronger. That responsiveness, when you do that with children, you do it with families, we are trying to do that with you in responding to these emergencies, creating systems, creating these quarterly meetings. And as we learn and grow together, this team will be learning from you. And we're expanding our reach and working in health inspections for schools, and that includes private and public. So our reach is getting larger and bigger, and we need you even more in how you teach us to be a good partner. So thank you for all that I've learned and all I've done to be part of your system. And I'm not going away. So I'll leave it at that.
Thank you so much, Jane. We appreciate you so much and all the wisdom that you've passed on to us as inspectors and within child care. So thank you. Okay, now we will hear from Amy, who's with Early Childhood Council of Boulder County, ECE BC. I saw Amy.
Sorry,
on
I was
here.
on mute. I was saying,
Oh,
I was really
wonderful.
impressed of that. I was really impressed of that 4 slides of Jane. I laughed out loud when you said 3 slides, no 4 slides, but that was really nice. Hi, I'm Amy Carlo, the Early Childhood Council, Boulder County, and hopefully many of you received this notification from us about an upcoming training that we're hosting in partnership with both Carmen Ramirez and El Comité de Longmont. And it's about the State Bill 276 and how to incorporate that into your emergency response plans. And we'll be talking about that as it relates to immigration enforcement and supporting the families that you work with. And then there's a second session also to that where we will really focus on trauma responsive care for all families, for all children in your care. And if you have questions about that, Ursula, one of our coaches, will be co-facilitating this, and you can reach out to her. Her email is there at the bottom. And please register. There's an option for in-person or virtual, and we'll hope to see you there. And then I think we have there we go. The Director's Leadership Series, we relaunched that this year, so we wanted to make sure you were all aware, and we invite all program leaders, directors, assistant directors, infant nursery supervisors, classroom leaders to join. This year we're doing we're meeting every other month, and it will be topic-based, with room for people to just talk about what's on their mind. There's been, of course, a lot happening lately. So whether that's the current latest things or just to share information with other program leaders, it's a good time to connect and network. Our next Directors Leadership Series is on March it's the last Thursday of the month. I can't remember the date offhand, but it's in March, and we have a licensing specialist that will be joining us. So it'll be a good time to bring your questions, and hopefully we can have a nice group there. And so please register if you haven't already, and we look forward to seeing you. That was. Those are the topics, yeah, and it's March 26th, if I can read right there.
Yep, March 26th
March
with Christina
26th.
Palmier.
Yes,
CD.
She'll be joining us from CDEC. And you can see the other topics we have planned up until November. And so we're hoping that these will be of interest and also just provide you with more resources.
Wonderful. Thank you so much, Amy. If anybody has any questions, feel free to ask Amy or put anything in the chat. But thank you so much for keeping us up to date with ECCBC, all the leadership opportunities and connecting opportunities. So thank you so much. And now Serena with CCAP of Boulder County will be providing an update.
Hi, everyone. Thank you so much for joining. Martha, did you have the slide? Yeah, great. Thank you. So I'm Serena. I'm the Child Care Assistance Program Business Office Manager. Happy to be here today. Just a little update on the stacking payments for UPK and CCAP. It's going pretty well now. We have a pretty good process in place, and we are getting those reports from the state, and they come monthly for the children that are awarded 30 hours per week. So we aren't looking at the kids that are less than 30 hours, and we're comparing them to accurately see, how much CCAP they're using in order to stack the funds. And we contact the families. So CCAP will contact the families, and the families are given about 45 days to respond. And if there's no response, no amendments are made to the case at all. However, so right now to date, we have about 48 Boulder County children that have been identified as meeting these stacking requirements. And we've been doing it since last September 2025. And we have a pretty good response rate. I mean, honestly, that's pretty good, 67% response rate. And this just breaks down a little bit of information from September. The families were contacted and only 26 have responded, but that's a pretty good amount. And the 24 of those families need the authorization changes. Some don't. And so we identify those. And out of those 24, only 14% or 14 of those families needed a parent fee adjustment. So part of that is decreasing the parent fee because we will decrease the authorization. So 54% have had a parent fee reduction, which really helps out the families too. But we are reaching out now. We just got the report for January, and the outreach is underway right now during February, and we'll have a new update for you next time we meet. So thank you.
Okay, thank you so much, Serena. We appreciate all you do behind the scenes with all the business parts. So thank you so much. It truly
Very
takes
well.
a village, like Jane said.
Absolutely.
And then we just thought we'd share a few more resources with you. I know President's Day is coming up, and I don't know if you're going to have any professional development around this time period, but we've still noticed that our biggest violations for inspections is around sanitizing and disinfecting. So there is a free PDIS. There's a video that you can provide for your staff, and we put the link there. So that would be great for staff training. And then for your cooks, if they don't have their Colorado Food Handlers Card training, one opportunity would be for them to take this state food handler training, and the cost for that is $10.99, but just more learning opportunities. And then please pull out your calendars and save the date for our next Health ECE Partner presentation. Will be on Monday, August 10th, 2026, from 12 to 1 again, so before, at the beginning of the new school year. And then if any of you would like to receive professional development certification, I think Seaning will put this Health ECE at bouldercounty.gov in the chat. But please email us, and it'll be me that you're emailing at Health ECE, and put your first name, last name, and facility name, and we'll give you a certification, an official Boulder County Public Health letterhead. And just to conclude, thank you so much. I feel like our common goal is, as Boulder County Public Health and ECE directors and our partners, that we just all want to prevent the spread of disease, to keep our classrooms open, and to provide healthy spaces for children and teachers to learn and thrive. And we're always open to your ideas and suggestions, and we appreciate all the good work that you're doing. So thank you again for coming, and that concludes our presentation.